and Tasmanian branch of the Chapter of Addiction Medicine, and I'm very pleased to welcome him today. Thanks.
Thank you. Well, thanks very much indeed to Eleanor and others for inviting me to come and talk to you. I'll try and live up to expectations and to keep you entertained for the next hour. I am, however, happy to be interrupted, so if you do wish to ask questions, please feel free to do so during the presentation, and we'll just take things as they go. And if you wish to take things off on a bit of a tangent, that's okay with me. If it's something to do with medicine, I can probably answer it. If it's something else, then maybe not. I had a great deal of difficulty putting this talk together, and I don't really know why that was, and I was wondering, my psychiatric colleagues might think it might be related to the fact that you were a group of lawyers. I'm not sure what you call a group of lawyers, but I actually grew up in a house of lawyers, so I was always used to seeing these people sitting around smoking cigars and playing the piano and things like that, doing lawyer-type things. That wasn't me. I don't know what happened there. But I had great difficulty. I think it's probably because I'm trying to talk about some quite technical stuff to a group of people who I have to assume know nothing about it, and though some of you probably do. And I've done talks to the sort of lay public from time to time, and I sort of go at a very basic level, but I'm aware that there's usually the odd neurophysiologist in the audience who knows more about the brain than I do. So it's always a bit confronting. So if any of you do have doctorates in neurophysiology, just ask nice questions, not difficult ones, and we'll all be happy. So I'll move on with this. And just one minor correction to Eleanor. Actually, we do have a patient at St Lee's at the moment, but they're not in DePaul House. They're in the main body of the hospital. And the reason they're there is they're so medically compromised, they need to be kept in the hospital. And I think the sorts of patients we will be treating under the Severe Substance Dependence Treatment Act largely are very debilitated people who've got significant medical comorbidity, not the sort of run-of-the-mill type patients. So it's just a point worth taking on board, I think, because this is a distinct group of people. Anyway, this talk seems to be running away with me already, even though I'm just looking at this thing. And I'm just going to try and cover these topics here, which are the ones that were sent to me, and maybe that's why I had so much trouble, because I hate being told what to do. I was looking at these and trying to work out how to present this in a way that followed a little story, really, because I really want to go from A to Z of neuroanatomy, neurophysiology, and behaviour and things like that, which is pretty challenging for me, because I don't know much about it. Anyway, we'll try and talk about things in the context of Australia, because we live in a society where drug use is normal and alcohol use is very normal. And the majority of the population will use alcohol either excessively or moderately, and the harms associated with that are things that we are very accustomed to experiencing, whether we like it or not. Every time we put the TV news on or read the newspaper, we will often see some of the consequences of our society's use of drugs and alcohol. And it's important to understand, of course, that most drug and alcohol use in society is quite reasonable. It's not excessive. This really is running away with itself. There's a mouse on the floor, that's why. Just bear with me. Okay, there's a little thing down there that keeps moving. So whilst alcohol dependence or drug dependence is what we all think of as causing the harm that we see in society, the majority of harms are actually confined to a population of people who are not dependent. It's those who may drink, binge drink excessively, have a motor vehicle accident, fall out of a window, drown or whatever. And the drug taking is the same, that the majority of harm we see in the health setting, and to some extent in the social setting, are those people who are not addicted to the drug, but they're just using the drug. And they're having adverse effects of their normal, if you like, use. It's an important concept to understand, because we start to sometimes demonise drug use because of the awful things we see in the addicted people, and we forget that the majority of the drug-using and alcohol-using population are living totally functional lives most of the time. Okay, so here's the social context for Australia. Lots and lots of alcohol. Some of it's acceptable, some of it I would argue is unacceptable in terms of advertising. But clearly widespread use, and most of us probably do enjoy a drink or two. And talking about that, I thought it was important just to refer briefly to the standard drink, because a lot of people don't know what a standard drink is. For instance, if I ask my patients, how much do they drink, they say, maybe 2 or 3 glasses of wine. But in their eyes, a glass of wine is actually 2 or 3 standard drinks, and 2 or 3 glasses of wine is 3/4 to a bottle. So, of course, if you're rich and you have these big, expensive wine glasses and you tend to fill them up when you give yourself a drink, you're drinking at least 1.85 or 2 standard drinks each time. And it's important to understand when we are drinking, if we want to use drugs or alcohol in a safe way, how we do that. And, of course, we need to then keep our drinking at respectable levels where most of the time we're drinking within what is considered to be a perceived sort of level of risk. And we have to also quantify risk. Is risk the risk of the acute event, or is risk associated with long-term use? And there's a lot of debate about how safe is it to drink alcohol. In other words, there is some perception that if you drink a small amount of alcohol regularly, that lowers your morbidity from certain conditions like stroke and heart attack. And that's absolutely true. If you drink 1 to 2 standard drinks a day, and only that, bear in mind, you will lower your risk of heart attack or stroke. But if you actually increase your amount of drinking, then you cease to gain from the benefit of having a small amount of alcohol and you increase your risk. And it is most people who drink alcohol drink over that level. They might drink 3 or 4 standard drinks on some occasions. Then you actually increase your risk. And in the short term, that may not matter, but over 20 or 30 years of drinking, it might, particularly. And I can see about 60% of the audience or 70% of women in your case, because women are more vulnerable to the effects of alcohol